Submucosal tunneling endoscopic resection to treat a large symptomatic esophageal lipoma. No disclosures. This table shows the equipment that we have used. The patient is a 62-year-old male with a non-submucosal lipoma of the distal third of the esophagus that has been diagnosed with endoscopy, endoscopic ultrasound, and CT. The lipoma has grown in size and has taken up to 75% of the esophageal lumen and is causing dysphagia, 6.5 points on the Edinburgh Dysphagia score. The endoscopic ultrasound examination revealed that the lesion does not engage muscularis propria of the esophageal wall. We have decided to perform submucosal tunneling endoscopic resection for its minor invasiveness and because of the soft nature of the tumor. This is a preoperative CT image of the patient thorax that shows the volume of the lipoma. You can see a soft submucosal lesion protruding from the distal esophageal sphincter. The procedure started with an elevation of the mucosal layer with high volume solution. An initial mucosal incision was created with triangular tip knife 5 cm proximally to the lesion. The same knife was used to create the submucosal tunnel leading to the lesion. The progression of the tunneling was checked periodically. High volume solution was injected in all the sites of the submucosal lesion. A knife with an isolated tip was used to enucleate the lipoma from the submucosa and the muscularis propria. After the dissection was completed, a polypectomy snare was used to extract the lipoma. The lesion passed through the upper esophageal sphincter without difficulty. The tunnel was checked for bleeding and perforation. The initial mucosal incision was closed with 5 16mm hemostatic clips. This is a picture of the lipoma after it was extracted from the patient. There were no perforations or upper GI bleedings encountered during the procedure or the post-procedural period. The patient remained on meal for 24 hours after the procedure. We administered routine prophylactic antibiotics, third-generation cephalosporins, and the patient was prescribed proton pump inhibitors for a month after the procedure. A follow-up upper endoscopy was performed 3 months later. This is a short video from the Follow-up endoscopy on the third month after the procedure. Submucosal tunneling endoscopic resection is a safe and effective procedure for treating esophageal submucosal formations. It preserves mucosal integrity and shortens the recovery period. The procedure needs to be carefully considered in lesions over 5 centimeters, but in our case, despite the size of it, the soft nature of the lesion allowed us to extract it from the esophagus.